As winter creeps in and the chill bites deeper, the UK Health Security Agency, UKHSA, is sounding the alarm, for stubborn illnesses are on the rise, and they're urging everyone to dust off those face masks for protection. Picture this: colder days mean more sniffles and sneezes, with illnesses like flu, COVID, the common cold, and respiratory syncytial virus, RSV, making their unwelcome comeback. But here's where it gets controversial. Is this just sensible caution, or are we overreacting in a world still scarred by pandemic fears? These pesky bugs often mimic each other with symptoms like coughing, congestion, and fatigue, but don't be fooled, they vary wildly in severity. RSV, for instance, can hit young children and the elderly especially hard, sometimes leading to serious breathing issues that require hospital care. Meanwhile, flu might leave you bedridden for a week, and COVID, well, we've all seen how that can escalate. The UKHSA isn't mincing words. In a recent post on X, formerly Twitter, they shared a straightforward checklist: feeling under the weather? Help stop infections from spreading with this checklist for you and your family. It's a call to action that reminds us prevention is key, especially as these illnesses thrive in close quarters during the colder months. To keep things from spiraling, the agency lays out 5 practical steps anyone can take. Think of them as your winter wellness toolkit. Wash your hands regularly with soap and water for at least 20 seconds. It's simple but incredibly effective against germs lurking on surfaces. Always cover your coughs and sneezes with a tissue, then bend it immediately to avoid spreading droplets. If you're not feeling great, stay home and rest up. No need to infect your whole office or school. When indoors with others, crack open a window to let fresh air circulate and dilute those airborne particles. And yes, consider popping on a mask when you're out and about, whether it's a surgical one or a cloth alternative. It acts as an extra barrier. Stay ahead of the curve by subscribing to our newsletter for the latest health updates and tips tailored to you. Now, diving into the data, the most recent government figures show a modest uptick in COVID cases. In the week up to October 8, there was a 1.9% rise, signaling that the virus isn't quite done yet. But this is the part most people miss: these numbers aren't just stats, they're a wake-up call about how quickly things can change with the seasons. Diving deeper, COVID-related deaths have jumped significantly, up nearly 15% from one week to the next, climbing from 87 to 100 in the week ending October 3. And hospital admissions? They surged by 9.7%, going from 1,894 to 2,077 in the week to September 30, as reported in the Mirror. This isn't alarmism, it's evidence that even as life returns to normal, these illnesses demand respect. For beginners unsure about RSV, imagine it's like a more aggressive cousin of the common cold, targeting the lungs and potentially causing bronchiolitis in kids. Similarly, while the common cold might seem harmless, repeated infections can weaken your immune system over time, making you more susceptible to the big hitters like flu or COVID. By following these steps, you're not just protecting yourself, you're safeguarding your community, especially vulnerable groups like the elderly or those with chronic conditions. Yet, not everyone's on board. Some argue that masks and precautions hark back to pandemic-era restrictions that stifled freedoms and economies. Is this a necessary shield, or an overzealous overreach in an era of vaccines and treatments? Could natural herd immunity or vitamin boosts be underplayed alternatives? We invite you to weigh in. Do you support the UK's renewed focus on masks and prevention, or do you see it as outdated? Share your thoughts in the comments, agreement or disagreement, let's discuss.